I want to chat about asthma Hayfever because it's March. Pollen counts have been rising from February, and a lot of people with Hayfever and asthma are starting to feel symptomatic. So people with asthma are getting short of breath and wheezy, coughing, and people with Hayfever have runny, blocked noses, itchy, runny eyes, and none of this is very nice. My name is Dr. Brodski. I'm a GP working in the NHS, and privately I do anthroposophic medicine. I would do it in the NHS if it was possible, but in the UK, anthroposophic medicine is not very well known. In the German-speaking world, it's really well known, really well integrated. Even in A&E, you can get some anthroposophic treatment. But in the UK it isn't yet. Hence I'm doing these videos to bring this to you, because anthroposophic medicine is actually effective. It's mostly, all the medicines are plant and mineral based, and they typically have no side effects, and typically they are fine to use with the mainstream, the usual medication that you're already on. So, for example, with asthma inhalers, it's absolutely fine to use anthroposophic medicine. So I'm going to show you the backbone of asthma treatment in anthroposophic medicine. This is Gencydo 5%. It's made from quince, which is basically plant-based medicine. These are injections. You will be surprised because we normally use inhalers in mainstream medicine, but in anthroposophic medicine, injections for asthma are very, very effective. Now, when I talk about very effective, asthma is a reactivity of the body, reactivity of the immune system that, speaking anthroposophically, was produced for most people in early childhood when we had a viral illness, and at the same time we're exposed to pollen or other irritants like dust, and our body, our immune system, misassociated the pollen and the dust with the virus, and ever since our body, our immune system reacts to this pollen and the dust and produces inflammatory response in the lungs. And the same goes for hay fever. So same sort of reactivity that affects, but it just stays higher up instead of being right down in the airways. So the point I'm making is that it took some time to develop asthma, and it's gonna take some time to get rid of it. And yes, I do believe it's possible to completely get rid of asthma. I have asthma myself. I've been treating myself for the last couple of years, and my symptoms are certainly reducing from year to year. So the commitment to treatment is of immense importance, because it's not going to be an overnight process. It's going to take some perseverance on your part. So typically what we do, talking about the Gencydo injections, we would start in the winter with the lower strength injections, and then we would gradually increase the strength up to 5% towards the spring, when the pollen is rising, pollen counts are rising rapidly. We also have a number of oral medications, which would be my favorite for children, and I think it's within a few years it's possible to either reduce asthma symptoms significantly or even cure asthma. However, there are important aspects to consider here. I will never ever suggest that you come to me, you start this treatment and you just quit on your inhalers. Absolutely not. Anthroposophic medicine is actually practiced together with mainstream medicine. That's why I am also a qualified doctor and I work for the NHS, so both things I use simultaneously. The only time to start reducing, not stopping, reducing your inhalers would be when you have been established on the anthroposophic treatment and you have been pretty well, for months to perhaps a year, and then we could just start reducing the dose and see how you go. We would never do it in any abrupt way, because asthma can kill. Luckily, thank God and thanks to the modern medicine, it's not so common, but it is still a danger. So I want to now tell you something about another aspect, the soul aspect. I feel strongly that most of our illnesses have a strong soul aspect. So for example, just trying to think how to make it sound really, really simple. So asthma can be triggered by stress, strong emotional experiences and traumas in life. It can trigger they can trigger a lot of illnesses, including asthma attacks. And so working with our feelings is also really, really important. I have another separate video on emotion code, and whilst this system has not come out of anthroposophic medicine directly, I feel that it sits within anthroposophic medicine really well. So the premise for emotion code is basically that as we go along our life, as we live our lives, we trap certain emotions that are intense, are difficult to process and release. And we also inherit emotions from our predecessors. Sometimes we absorb them from friends or even people that we don't know that are on the same street. It just is a phenomenon that happens. We don't see it, but it happens. And I do feel that with asthma, there is a significant input from these trapped emotions into the symptoms of asthma. So releasing trapped emotions is actually really, really helpful. Just to say it as simple as that. If you ever do get to do emotion code, your practitioner often might tell you the location of the trapped emotions that they have released. So my emotion code practitioner, she basically releases my trapped emotions linked with a particular issue, say asthma, and then she sends me a report later in the day. And sometimes I get information where the trapped emotions were, and a lot of the trapped emotions, like fear, for example, are usually trapped in the lungs. So this is a little bit of a spillover of somatic medicine knowledge, which again is not popular in the UK, not yet unfortunately, but perhaps in the future. So I strongly feel that this holistic approach, mainstream medicine, inhalers, plus the anthroposophic medicines, oral medicines, injections, subcutaneous injections, actually easy to do at home, and plus soul work. So for example, I think we all need therapy and we all need a good therapist. I have therapy regularly for a long time and intend to carry on. So mainstream medicine, inhalers, anthroposophic medicine, and soul work, either emotion code or good therapy, or both, ideally both. And that may well, within a few years, depending on how dedicated one is to the treatment plan, this may well reduce the symptoms or even help you completely get rid of asthma. I do believe this is possible. All of these medicines, you can buy them, but the problem is you really do need a little bit of my guidance. You at least need to have one consultation to find out which remedies will be best for you. Gencydo definitely will be good, but you still need a treatment plan. So I am available. My charges are pretty reasonable. I hope you feel inspired to seek anthroposophic medicine, because it does work. It really does work. Bless you all. Bye-bye. Just a little addition, I didn't say enough about hay fever. For hay fever, we have eye drops, which are made from Euphrasia. So these are the eye drops. And there is also nasal spray, which has got several herbs in it, and both are pretty effective. The Gencydo also comes in the form of nasal spray. All of this is fantastic for hay fever.